Now, besides the fact that we've got literally millions and millions of people that, and there's just no other way to say it, if they won't step up and take responsibility for their health and pay health insurance premiums, well, they're just lacking in integrity and character. Now, you say, I know what you're just going to say, well, if they can't afford it, how are they going to buy it? Well, hey, I agree 100%. I mean, just people with low incomes can't pay the health insurance. The cost of health insurance benefits contracts today is what it is. It is what it is. It's you don't think if it could be lower, the insurance companies would like to sell it lower? I mean, the cost is what it is. That's the premium you pay. Now, the people that can't afford health insurance, the low-income people, we have always in this country figured out a way to take care of people. This baloney that we don't, the people, some of these people want to promote that we're not a sensitive nation and a caring nation. Look, there's nobody that takes care of people here and in the world with more money than the United States of America, and it's always been that way, and it'll always be that way. And the day that it starts to be that we don't have that attitude as a people, we're done as a people. We're done. It's over. Look what's gone on in the world with the nations. They've got themselves in such bad shape, they cannot go out and help the dictators and tyrants that are murdering people by the tens of thousands around on the globe. We're always there. When the chips are down, the United States of America is always there to help them people and separate them so they don't keep killing each other. So, this business that we're not we're going to take care of people. But the people that have got the incomes, if anything, it ought to be like, it ought to be a situation where, hey, if you're making the money, here's the insurance premium. Here's a good competitive insurance company out here in the marketplace. Here's a list of them, and they're approved by the state, approved by the federal government. Which one do you want? I mean, that's how it is when it comes to driving an automobile, because we had a situation where people wouldn't take the responsibility for the property and the health and well-being of other people that are driving on the street. So now you want a license, you're gonna have in most cases you're gonna have automobile insurance, or you're not going to be driving, or if you do get caught driving without it, there's a penalty you're going to pay. Well, there's always going to be people that are going to try to beat the system, and that's why we got law enforcement. That's why we have laws, so that people, because you're always going to have people that aren't going to abide by the law, and you just can't put up with that. Okay, so now let's talk about the history of health insurance. Back in the day when Blue Cross and commercial companies decided, Blue Cross selling a lot of insurance, we're going to get in on this deal, and fine, it's a free enterprise system. Let them come on in. Water's fine. The problem is when you start using health insurance as a group health insurance, as a corporate recruiting tool. Think about it. Hey, come on over here and work for us. We got better health insurance benefits. You think the other companies are going to stand still for that? Not a chance. They're going to jump right in there with both feet. They're not going to let the good workers go all to 1 or 2 or 10 companies, to 50 companies. No. Everybody, and the insurance companies they love it. They love it. Sure, they're going to jump right in there and show them, well, we got better group benefits than this other company. Somebody's always going to pay. Somebody's always going to pay. And then over the years, you had rising healthcare costs. We had the old heart transplant come on the scene, and now we can take cataracts off people's eyes, and the medical progression of treating people's health has just been phenomenal in the United States of America. But there's a cost associated with that. And so combination of that and people going out here and using health insurance, group health insurance in corporations for a recruiting tool. It's crazy for that to have happened. And that's one of the reasons with the healthcare costs rising like they have. Now, it used to be when you went to work for a company, they said, "Well, don't worry, we take care of that. We pay that." They didn't pay nothing. Hey, that came out of the cost of having you work there. You paid that. They just paid you less money. That's all. You think that companies gave you that health insurance? Oh no. If you think that, then I got a lakefront property in Arizona I'd like to talk to you about, where there ain't no water. But by the time I get done with you, you're going to think it's the greatest lakefront property in the world. It isn't any better at the Virgin Islands. You paid it. You pay it at the corporate level, this group health insurance. You pay it. It comes, if they weren't giving you that, you'd be paying you more salary. So let's get real. Hillary wants to get real. Yeah, let's get real. Well, why don't she say that? That there's no free lunch. No free lunch. Over and out. Keep tuned. It's getting hotter and hotter and better and better.